Hello, good day, Shalominators. All right, on today's video, we'll be discussing about IT, industrial training, the one that we do with COS, addressing it from the physiology perspective. So those of you doing your bachelor's degree in physiology, this video is for you. All right, so you can like and subscribe and follow. All right, so in today's discussion, we'll be looking at IT, industrial training, and how that's very important in today's world. Okay, many of you will attest to the fact that when you went for your IT, that's where you really had interests. Okay, that's when your interest sparked about your profession. You would have been thinking, "Oh, school na scam. Who is scamming you? I'm definitely not scamming you." Right? So you would have seen the practical aspects of some of the things that medics and paramedics can do. All right, and that's very important. So as a physiologist, there are many hands-on skills that you can imbibe. Okay, many things you can do within the context of a clinical setting or a laboratory setting, and in some other places too. Some went to do in sports physiology areas, etc. So there are many things you can do as a physiologist, and you would have learned that during your IT. Now, there are important things for somebody doing IT who is a physiologist, somebody doing B.Sc physiology program to note. All right, I'll be exemplifying this my talks with B.Sc physiology. However, you can also pick some things if you're also doing IT in other courses. Okay, if you're a student of maybe pharmacology, MBC, medical biochemistry, you can also pick some things. All right, so let's start. First and foremost, describing this process. IT is industrial training, okay, and you know the essence is for you to pick hands-on skills. So we are very much interested as lecturers in being certain that you have picked up the skills, not just knowing the theory now. The theory was what you were learning about when you were in school, in the classroom, all right, and you did some practicals, but not as hands-on as the extended 6 months or 3 months, as the case may be, that you're going to be having in the industry. So you want to make sure that being placed, number one, being placed, you are placed in such a position or a location in that facility where you can have hands-on experience to the things that relate to your discipline. So if you're a physiologist, you want to make sure that you at least can handle some basic physiological tests that concern different systems that you have studied. For instance, the cardiovascular system. There are things like ECG, okay, your regular blood pressure monitoring, etc. Okay, so you want to make sure that even echocardiography, if they can do those things in a facility, you want to make sure that you are attached to a place where you can understudy those procedures. All right. There are also aspects in renal like dialysis. Okay, I'm aware during the course of supervising some students, I saw some students being able to carry out dialysis under the supervision of an industry-based supervisor. That's very important. So you want to pick up meaningful skills that concern the systems that you have studied during the course of your study. And then I understand that not all of us may be able to, not every student may have been able to do their IT in a big facility. So they may not be doing things like dialysis, ECG, and the rest of them. But they may be doing little things like laboratory tests. So if you were able to find an IT place in somewhere that just has a lab, okay, somewhere that's quite small, maybe a small health facility, all right, it's important for you that you tilt towards things that concern physiological tests or that may assess physiological parameters. For example, hematological indices, okay, things like packed cell volume, okay, the study of blood. That's because we have a whole course we call blood physiology. And if you remember some of the tests that were done in our laboratory when we're teaching you blood physiology or introduction to physiology, some of these tests were implicated. It's important. Things like blood count, blood typing, okay, checking for both genotype and also ABO blood grouping. Those things are very important. Okay, so don't just concern yourself. If you're in physiology, don't just do or focus on everything in the lab. It's important you can learn everything, but focus on the things that concern your discipline, things like hematological parameters, e.t.c. Okay, so look at ESR, erythrocyte sedimentation rates. It's one of my favorite ones. I like it. Okay, so study it, understand it. Packed cell volume too, using a hematocrit. Okay, study that, understand it. It's also an important thing and an interesting concept you can explain. Study how to interpret those results. First and foremost, how to carry them out, the procedures, all right? Step-by-step processes. And then the precautions associated, how to measure that, etc. Okay, and you know those things, you're good to go. All right. You can also look at Aspects like blood grouping, like I said, ABO, e.t.c. Find out how to interpret those findings and what it means in correlation to physiology. All right. So the goal is to merge theory with practice. All right. To merge the practical and the theories that you've learned. So the theory that you've learned in the course, okay, whether it's renal physiology, blood physiology, etc., you have to now know the practical aspects and how to apply them. If you have this, it's very simple. Okay, you can make a good IT presentation. All right, so moving one step forward, I'll be looking at the IT supervision itself. Some of you may have been supervised, particularly those of you in 300 level, but there are many more who have not been supervised. So I'm talking people in maybe sophomore, the 200 level class going to 300 level. So the 300 level going to 400 level may have been supervised. However, okay, it depends on the time you're watching this video. So many people may as well not have been supervised. This video is for you. Why is this so important? Okay, for you to have a successful IT supervision, you have to have a good knowledge of specific tests or procedures that have been done that relates to your discipline. So if you're a pharmacologist, you're a physiologist, okay, identify several tests that are very related to your discipline and know them step by step. You have to be bold, you have to be receptive, you have to be comfortable, confident when giving your presentation. Okay. So your IT supervisor is going to come and ask for your basic identity details. Make sure your logbook has been well filled, and everywhere where you have to have your name, etc., okay, those primary details on your forms have been filled appropriately. Okay, your logbook is up to date, you are filling it and you are signing it regularly with your industry-based supervisor. If that is available, your IT logbook, your form C, okay, and where you have to fill your name and address, all those things, you fill them down. Okay, also make sure your industry-based supervisor is around because you'll be needed during your assessment. So you make sure these necessary things are around and you are good to go. So if the knowledge is here, and they're asking you, whether they're asking you as a group or they're asking you as an individual to explain it, please comfortably explain in detail how these tests are carried out. And if you can do some physical demonstration, that would be expected. All right. Make sure that you make the most of this presentation, and all the questions that are asked you, you at least attempt them. If you are not so certain, of course, you could indicate that you are going to know more about it within the short time that's left, or you could get the assistance from your industry-based supervisor, or better still, indicates that you've not yet learned that part. Okay, but focus on establishing more, explaining more on the things that you actually do know. All right, that will help you and give you an edge. So you may pick a focus area. You don't have to explain on everything. Okay, you may pick a focus area, except of course they ask you specific questions on certain areas. All right, so I'll move it one step forward to report writing, and then I'll talk about IT defense. So in the writing the report, okay, there are different structures that you would have in your IT report. I'm going to display on the screen some of the outlines we've had over the years. Okay, these things are transient, so please mind you, as a disclaimer, it may differ by department. So what I'm giving is not a standard for every department or for every season. So it depends on your IT organizer or whoever is in charge of IT in your department at that particular year. Okay, they may have received a different instruction from the COS office in your institution. So it depends on the peculiarities of departments. Okay, so but I'll show you examples of structures, showing on your screen, structures of outlines that people have used for their IT reports. Make sure you also outline those things. You explain those procedures that were done in the place where you did IT. Please do not copy somebody's work and just put procedures that you are not certain of, things that they did not do in your own place of industrial training. Do not just copy it from someone else and put it in your work, because questions may just come from there and you're asked to explain something. You can explain tire, no evidence. So please make sure you do not do copy and paste or just replicating what someone else has in your work. All right. So lastly, for the IT defense. Now, having done that, in some department like ours, there's an IT defense, and that's fixed for after supervision is done and after IT is done. So when school resumes, they start with an IT defense. This looks like a project defense, a seminar defense, because you come up, you make a presentation, and then they ask you questions. So you have to prepare this information that you have put into a Word and printed as a hard copy, which is your IT report, right? You have to prepare, pick meaningful points from it, or select a particular test, which is usually what we recommend. Okay, I would explain further. And then you make that into a PowerPoint slide, and then you present on it. Okay, after which they will ask you specific questions and you will be scored for it. Okay, so please, what I recommend is that you can pick a particular test actually to talk about, one of the major ones that relates to your discipline and that was done in your place of IT. Then you explain about it and you talk about it. Okay. You may start your discussion. I think there's an order. You start, you introduce IT and you introduce your place of assignment, and then you go into further detail to what test exactly you are going to be talking about, what procedure you're going to be explaining. All right. So, don't just tell us about the place where you did IT, how wonderful it is. All right. You just have a little opportunity to talk about that, but also showing on your screen are some examples of how you can go about outlining your work for presentation. Perhaps there'll be more videos throwing more light as to examples of presentations of IT, PowerPoints. All right, just to show you how you can learn from this. So in defending your work, please be confident. Make sure all your details and procedures are correct, but also explain. Now, if there are standards that were maneuvered, okay, also make sure you can be clear in such instances. Tell us the way they did it in the place where you did your IT, and also tell us the standard procedures. And you can also make recommendations and conclusions around this. All right. We trust this video has been helpful. All right. So you want to stay tuned for more information. But don't forget, if you're an IT student out there, make sure you use some of the tips that we have shared to have a very beautiful and robust experience and have a great presentation when you actually present for your IT. Okay. Follow the advice I've given, and then some of the explanations will be at the comment section. Thank you very much. God bless you. Have a great one.